Hi, this is Dr. Aashish Taneja. I am the director at Delhi Bone and Joint Clinic. I am a senior orthopedic surgeon and joint replacement surgeon. Today I am going to talk to you about a condition called AVN or Avascular Necrosis of the hip. ये चीज़ आजकल ज़्यादा कॉमन हो गई है. We hear this term very often, especially after COVID. Reason क्या है इसका? Reason ये है कि in COVID a lot of us had taken large doses of steroids to prevent lung worsening, and these large doses of steroids has caused its damage on the hips. So this is how a normal hip looks like. We have a very smooth, shiny ball which fits into a smooth cup like this. But in cases of AVN or avascular necrosis, because of a number of conditions, especially in patients who have taken steroids, this ball can get damaged because of the blood supply. जो blood supply जाती है इस ball को, that can be damaged because of steroids and a number of other conditions. The ball will become irregular. वो smooth surface खत्म हो जाएगा. At some points there can be depressions or defects also of the smooth surface. अब बहुत नॉर्मल सी बात है कि अगर दो uneven surface आपस में move करेंगे, it will cause a lot of wear and that can lead to lot of pain and eventually arthritis हो जाएगा. अब बात है कि अब जिनको ये चीज़ हो गई है अनफॉर्चुनेटली बिकॉज ऑफ कोविड और बिकॉज ऑफ स्टेरॉइड इनटेक, तो उनका ट्रीटमेंट प्लान क्या है? AVN or avascular necrosis is divided into 4 stages, 1 to 4. It is always good to diagnose and catch AVN in early stages. So stage 1 or stage 2 AVN can be preserved. Stage 1 or stage 2 AVN में what we do is a very simple procedure called core decompression. And what is that? Core decompression, we drill one or two holes into the neck of the femur, into the head of the femur. So these holes will help in generating the blood circulation back into the head or ball of the femur. उन holes के through the blood supply goes back into the head of the femur. So the damage is stopped. जितना हो चुका है उसको आप reverse नहीं कर सकते, but it prevents further damage. So if we have diagnosed and caught you early in stage 1 and stage 2, there is a good chance we can preserve the hip for a lot of years. Unfortunately, if we get to see you at a later stage, that is stage 3 या stage 4, जिसमें कि आपका हिप का सरफेस ऑलरेडी खराब हो चुका है, उसमें डिप्रेशन बन चुके हैं, डिफेक्ट्स बन चुके हैं, then hip preservation becomes difficult. Stage 4 में आपका कप सरफेस भी इन्वॉल्व हो जाता है और आर्थराइटिस ऑलरेडी शुरू हो जाता है. Then it becomes difficult to salvage or preserve the hip. Eventually, we may have to resort to something called hip replacement. Hip replacement in which we will have to change the ball and the cup of the hip joint. It is a very good procedure, very predictable procedure and very rewarding procedure, but we'll have to do a hip replacement nonetheless. So I would urge every one of you that in case you or somebody that you know is having a lot of hip pain, especially on walking, and especially if he or she had COVID and had taken a lot of steroids, it is sensible and it is advisable to see a specialist and get a diagnosis made. Thank you very much.